mask mandates are discussed by the Shaftesbury and Bennington Select Boards.
This afternoon, the Health Commissioner Levine, Dr. Levine, and the Secretary of the Agency of Human Services called together the Bennington County delegation to share with us what we already knew, the high COVID counts in Bennington County recently. Bennington and Rutland counties have both been experiencing unusually high counts, unusually high related to the rest of the state and historically for us too. And they asked us to do what we could just to encourage people who weren't already vaccinated to get vaccinated, and also to encourage people to wear masks anytime they're indoors for any prolonged period of time. Not just in public settings, but in private settings. And apparently a lot of the spread has been people getting together, not necessarily with family, but other people. It might be for a party, but it might not be. That's where a lot of the spread has been taking place. So, those of us who were in the legislature have been encouraging the governor, some of us encouraging the governor to reconsider his opposition to another mandate, a mask mandate. And he's got good reasons, I think, for being concerned about a mandate. But it's also challenging for us. We don't have the authority that the governor has to say, get a vaccine. We know we've been spreading that message and spreading the mask message. Earlier this morning, I was at a press conference with the governor in Bennington. He was down to celebrate the completion of the water line extension in the town. And he mentioned that he was going to be meeting today with the Speaker of the House and the President pro tem of the Senate to share an idea that he had for reaching some sort of compromise. And just a little bit a while ago, news came out that his idea was to bring the legislature back in session sometime in the next couple of weeks. Normally we wouldn't be there until January, but to bring us back in session, he's proposing that we pass a temporary law that would allow individual towns to, if at their discretion, pass mask mandates just within their communities. So you may recall that Shaftesbury took that step last summer, I think it was in July 2020, before the state had made any decision. At that time there was an emergency order in place so towns could do it, and you can't do that now without that emergency order. So I'm here to, I guess, deliver two messages. One is that assuming we do go back into session, and I think it's likely, although I don't know for sure, and assuming that we pass that legislation, then the town would have that option if it wanted to have a temporary mandate in place again. And I'm remembering that there was a request specifically from a business owner in Shaftesbury that didn't feel comfortable saying to its customers, you can't come in without a mask, and was asking to have somebody else at the town level or the state level make that decision for them. So that'll be an option, presumably, that you'll have. And the second is just to say again that the commissioner, the health commissioner, who speaks for the governor, said everybody should be wearing a mask, even in a setting like this. So that's why I came in with a mask on.
That's political theater.
Well,
It really is. There's no science that says those masks work. Actually, the science proves that those masks, that one that you're wearing there or a hat on, does not work. It's like 10% effective, I believe, that the science shows. That it's all political theater. We are the highest vaccinated state in the United States, and we also have the highest COVID count. That tells you what? It tells you the vaccine doesn't work. The other thing that we've been finding out through science is that the people with these new variants are actually being spread by the vaccinated, not the unvaccinated. So bring a message to them and let them know. Take a look at the science. Really, those masks do nothing. Nothing.
So I'm sharing what I heard today from the health commissioner and just letting you know. Mm-hmm. And if the board has any message that you'd like me to take, obviously will. Yeah. But the concern is that counts are higher, the hospitals are getting to a point where they're near capacity, particularly for ICU beds. We're okay here at the moment in Bennington. The situation is challenging not just because of COVID, but because of a staffing shortage that is affecting hospitals as well as everybody else. And at some point after Thanksgiving, things may take a turn even for the more worse. So
I just wanted to just interject for a second. With the mask mandates and all these other mandates, this has really caused a lot of division and problems. People are actually leaving their jobs. It's not good. People in the health service, people that are in police, military, people are leaving. This is not a good time to be, playing political theater with people's lives, and especially when it comes to the jab. It's up to the person, the individual. It's not up to the Joe Biden or con man Fauci to decide that. So.
okay, thanks, Joe.
And I'm sorry if I feel, if I come across abrasive. I'm sure I am, but I'm really just at a point where I've had it with the whole thing. It's time to say goodbye to it.
Well,
I mean, we can respect it, know that it is a real disease. We know that it can harm you, but it also has a 99.8% survivability. That we also know. So you've got to ask yourself a question. With that as a survivability, do you need this emergency use authorization only vaccine? The answer is no.
well,
You don't.
You'll have your chance to vote, okay?
Thank you, Art.
All right.
I'm sorry, and I guess it just struck a chord.
Okay.
Sorry again.
It's been striking a chord with a lot of people.
Yeah.
I know that, Joe. So, yeah, no, don't apologize.
So, is there a message that Joe has voiced his opinion? Anybody else?
I agree with him. I think that I've had 3 shots. If you're going to have the shot, if you have the shot, why do you have to wear a mask all the time? I'm sick of government telling me every single thing when I can wipe my nose or go out the door or in the door or anything else.
I think people have forgotten about the common good. It's not about individuality. It's about the fact that we are, in fact, a herd. We are a population, and we owe it to each other to take care of each other, not ourselves as individuals. I don't find it offensive to wear a mask, although I know there are people who are offended by that. I think the tactic has got to be another way. I think, we're not reaching them. I was interested to hear that one of the governors has stopped funding for people now to get their shot. It's too late. You are spreading the virus. You are the ones who are incubating the variant. The Delta is only the beginning. The next one is the Mu. And that's in there. It's in us, and it's happening. The virus has no other job but to multiply and increase itself and spread. It will spread. I've seen people die. My own children have gotten the virus and suffered for 2 weeks, lost a lot of their senses, are still a little foggy. So I'm telling you, I don't know what the answer is, unless those people who aren't vaccinated finally die. And that maybe it'll be too late by then. But I'm sorry, we have got to talk about the common good. Thank you, David.
Mike?
Well, I can say I had COVID-19 2 years ago, and I survived it. And it had me in bed for 4 days, cold chills, all that fun stuff, kind of a test of your mortality. But, I snapped out of it on day 5, and about 3 months, Tony, it took me to really shake it off. It took a while to actually feel good again. Yeah.
5 million people have died,
Yeah.
so it's,
Well, like I said, it's a 99.8% survivability.
so
Unless you have underlying conditions, then of course that
does the
changes.
board want to take a stand on whether we meeting here with mask on or anything at this point, or?
I think if a business owner doesn't want, or want somebody to wear a mask, I've seen a lot of people say, get a sign on the door. Unvaccinated, wear a mask. If you got vaccinated, you don't need a mask. I think that's the way it ought to be left.
How else can you build faith in the vaccine if you don't?
We wouldn't be voting on anything right now, though, would we?
No, just, you know,
Just tossing around.
No, I support common sense public health measures. I actually worked at the NIH for Dr. Fauci. He was my boss's boss, and he's not a con man. He's a very good man and a scientist, and everyone who works at the NIH is working for public health. I still work for the NIH as a freelance graphic artist. They're not trying to con anybody. They're trying to help. It's controversial, I know. Not everyone wants to get stuck with a needle, but
It's not that. It's just that he has flip-flopped on everything. Not to get into a
No.
debate about it, but he's been proven more wrong than right.
yeah,
So-
I'm just gonna, that's BS.
So you think this may
No,
happen?
it is. Well, I don't know where you get your news from, but it's off the meter.
No, it's not.
Yeah, I think that,
You think it will be pulled back into
I
session?
think it's likely, yeah.
Okay.
So, when and if that happens, you'll have a chance to talk about this, which I'm sure you'll all be happy to do.
Yeah.
Again.
Okay.
David, do you know what percentage of actual American citizens in Vermont are not vaccinated? And is it these people that are getting it, that are not vaccinated, are they, I'm going to say Mexican or southern border immigrants?
No, actually, from what Dr. Levine said today, it was largely, right now, children, under age 11, and until recently, there hasn't been a vaccine for that age group. So it's largely unvaccinated, not entirely. We know that there are certainly breakthrough cases of people who haven't vaccinated. And haven't seen any recent data that would support the idea that there's any racial disparity in who's getting it. It's mostly age-related. So,
The last numbers that I saw of children that got it, unless they've got underlying medical problems, it's less than 1%, get even hospitalized or sick.
I think that's correct. Yeah, they tend not to get as sick and not to.
Unless they're obese or some kind of medical condition.
Yeah, they do transmit it though to
Right.
other, possibly older people who would be more vulnerable.
All right.
But we still don't know the full consequences of having COVID.
No.
I was a breakthrough case, and I'm foggy sometimes. My wife had a stomach ulcer. Is that all because of it or what? I don't know, so, yep.
Well, I know that obviously it's a subject with a lot of controversy surrounding it, and I think having this conversation in a civil way around the table is a productive way to do it,
Yep.
and so I appreciate your letting me speak to it.
Is just a few words on mask mandate. As many of you know, the legislature took up whether to allow communities to put in place a mask mandate that could last up to 30 days at a time. And, this is increasingly a complicated issue. On the one hand, it gives the communities the opportunity to tamp down on outbreaks by increasing mask indoor usage in public places, and this is absolutely a proven strategy. It also creates frustrations around enforcement, as we've seen with our last mask mandate. The police are not going to come out and arrest people for not wearing their masks. It also can bring out some uncivil behavior, and that has been directed toward the town. It has been directed toward store owners and other business owners. And apparently it also can cause some confusion about whether vaccinations, which are the key to bringing COVID under control, are needed if we're all wearing masks. I personally would encourage everyone to look at the alarming numbers in Vermont and Bennington County And also Vermont Digger has an article called The Deeper Dig, the case for mask mandates, both of which are, can be found online, and I would say, present a pretty compelling argument for mask mandates. We're not going to take this up tonight, but what we would like to do is to think about when we want to do that. We have 2 possible dates coming up. On December 6th, we are planning an executive session for town manager review, and we could add a public, we could have a public piece of that to take up the mask mandate. We could also wait for our next regular meeting, which is December 13th. So in either case, we would be looking at whether we should put in place an indoor mask mandate for 30 days, which would cover the holidays and also the tourists that come with the holidays. So, I wanted to ask the board what their pleasure is on this. Does anyone have strong feelings about when we take it up rather than what we take up? Yeah.
Thank you, Madam Chair. I'm not sure that I have strong feelings, but I think bringing it up, so long as we know that since discussion has taken place, that we could adopt something on the 13th, which is what I would want to do, that would be my preference. And it's a preference partly because that's a standard date for us. And I think there's something to be said for that, giving people notice. So if the chair would agree that on the 13th, should we choose to do it, and I for one hope that we do, given the numbers that I just have seen for this last, for the last 24 hours, it would be my hope that we could act on the 13th. And I do realize that enforcement, this is really a matter of self-enforcement. And I don't want to add to the burden of the retailers, but I really do think, in some sense, at least somebody can put the onus on us. We are the ones that are making the request, and it creates, it seems to me, some possibility that the retailers will have an out from that. I mean, in other words, they can just say, well, it's the town ordinance. So if we can act on the 13th, then that's the date. If we can't, then I would go with the 6th and then the 13th.
Okay. Anyone else have feelings about this? Tom, I'm sort of looking at you.
Yeah, I'm having surgery on the 7th. And there's no guarantee that I'll be able to be here by the 13th. So I am for a mask mandate in town. I've spoken to numerous retailers, and they kind of would just as soon have the mandate as a backup. And I didn't talk to any that were opposed, and I will keep asking. But yeah, if I'm to vote on it, we have to do it on the 6th.
It would have to be the 6th, yeah. Yes, Jean?
At this point, I'm not going to get into how I feel about it one way or the other until I see the language of the mandate. I'd like to leave open the possibility that we adopt something, but not necessarily what the language of the mandate is, and I haven't seen it yet.
Well, and actually, I did not intend to put you guys on the spot about anything other than just the 6th or the 13th.
Oh, okay.
Yeah, that's,
Oh,
yeah.
I'd just like to provide a little information. People in general may not be aware that both houses, both the Senate and the House of Representatives, voted to accept the mask mandate. And if you're interested in looking at the new law, as soon as Governor Scott signs it, is the number on the bill is S1. That's all.
Okay. Thank you. Thank you. Did you have more to say? Do you have a preference of dates? I mean, I want Tom to be able to be here.
I know, me too. That's the, no, I'll go with whatever.
All right.
don't-
I mean,
There's good reasons to wait, and there's, yeah.
Right. I mean, I think the having Tom here would be nice. I don't know Sarah's availability. But, Gary, you have thoughts?
Yeah, I would like to know what our medical advisors would say about a mandate, whether they think it's
Yeah.
effective, what their thoughts are on it.
Yeah.
It'd be nice if we had, I don't know if we can get Trey to speak to us on the 6th, or if that ends up at the regular meeting. on the
Trey is
13th.
coming on the 13th. We did reach out. The hospital does not have an official opinion.
Okay.
Okay. So it really is, I think what we're being encouraged to do is to look broadly.
Tom, depending on how you're feeling, is there a way that he could participate?
He's supposed to be out for 2 weeks.
Not-
possible.
Not be
but-
physically here.
Yeah. I mean, it's possible, but I have no idea.
You just can't say, okay.
At this point,
Okay.
how bad I'm going to be.
He's going to be on this. Yeah. Okay, so, Gary, did you have so we did reach out to Trey, and the hospital does not have an official position on this.
I can say that while I would prefer to be here, I do take Gary's point. Trey has been guiding us pretty well, I think, through this whole thing, and his input would be of value, I believe. So, yeah, I think I would actually lean toward it probably being better when Trey can talk to us and at least give us some advisement. But that's,
Okay, all right, so 13th it is then? All right, and Tom, will hope that you can join us on the 13th. Yeah, yeah, particularly if it's for one issue. Yeah. Okay, all right, thank you very much on that. Sorry that took so long.
To view this video in its entirety, tune to our channels or our YouTube page, Cat TV Bennington.